Okay, welcome back into the studio. That was Anne-Marie Berger from the 9 Network reporting for us there. She was definitely starting to touch on what we're going to talk about here, Amy Bluen from the Missouri Budget, Missouri Budget Project. I second-guessed myself for the last second there. A nonpartisan organization that analyzes policy here in our state. She kind of started to touch on some of the dollars and cents of this a little bit there, the benefits of primary care. Is this, you've looked at this expansion as a policy. Is this something you can talk about in dollars and cents for our economy? Does it kind of pencil out in some way?
Yeah, absolutely, yeah. There is a significant fiscal impact, a help to our state's budget, and an economic impact for employers, for individuals, for our communities, for hospitals and the healthcare industry.
How so? How? Because we've heard, I mentioned it earlier, the governor said it's not only kind of the moral thing, but it's the economically smart thing to do. Why?
Right.
Why is that?
Well, let me give you one example.
Okay.
You know, the Hospital Association did an analysis of the impact on the hospital industries and ancillary industries and communities where they would potentially receive the funding to care for people, you know, under the Medicaid expansion. And their analysis indicated that we would create 24,000 jobs in the state just as a result of the federal funding. That's huge. You know, if you look at that compared to what our unemployment rate, it's a significant impact for us in terms of jobs that are related directly to the Medicaid expansion. That makes sense. That makes sense for our communities. It makes sense for our hospitals and for all of us when we're looking for care, to know that those care industries are enhanced by the Medicaid funding.
Does it make, is it different for different parts of the state? Joe was touching on just a minute ago the rural hospital.
Yeah, and I'm glad they brought that up. Definitely the rural impact is going to be much more significant than in urban areas. Urban areas where hospitals can somewhat absorb caring for the uninsured, and rural hospitals don't have that luxury. So if the rural hospitals and their financing is compromised as a result of not expanding Medicaid, we could see rural hospitals closing, we could see a lack of providers and healthcare resources for everybody. It's not just about the Medicaid population, it's about all of us.
So that's where you might see some jobs lost, unfortunately. But back up for just a second there, you know, when the hospitals come out with a study that says this will create jobs, people might have a tendency to roll their eyes and say, well, of course they're going to say that. Do you really, truly believe this will create jobs?
Yes, we absolutely believe it. I mean, and first of all, let me back up. The hospital report was an analysis that was done by economists at the University of Missouri. And they did a really good job of looking at a modest scenario for what jobs would be created. So it's rather, if you will, it's a conservative estimate. It could be even greater than that.
Okay.
We use those economic models for all sorts of things, you know, in the state. We look at transportation and what investing in infrastructure and construction, what that would create in terms of stimulus. It's the same kind of thing. You know, if we've got an influx of federal dollars to the state, it's significant. It has a good impact. And it also helps us with our state budget, you know, and that's going to have a particular benefit for us right now as we're still struggling with the state's budget.
Is there a population that is just simply not in the marketplace, so to speak, right now that would create more demand, thus create more jobs?
Absolutely. You know, we right now have more than 800,000 people in the state who are uninsured. By pulling those folks into the covered, if you will, those with insurance, it will help us not only in the healthcare industry, but also, you know, folks who are currently working in small businesses, which is one of the largest growth areas in the state in terms of jobs and the economy. Those folks could have the benefit of being able to be entrepreneurial, if you will, you know, that they'll be able to take some risks, to look at different opportunities and know that they will be, there will be a cushion for them.
Of course, when you say the influx of federal dollars, I know there are those who will say those are federal dollars aren't free dollars, those are our dollars that go to the feds first. What do you say to those folks?
So a lot of things. You know, we do contribute to that pool of funding from the federal government. So we should, use this as an opportunity to leverage some of that in return. We also know that because the Affordable Care Act was fully federally funded when it was passed, meaning that they offset costs within the bill with decreases that existed previously. That means that it's money that does not add to any deficit. It will create a boom to the states, and it just makes sense for us to do it.
Are there savings that we could have if we do expand too? We're talking about creation of jobs and different influx of money. What about any savings?
Absolutely. The state's budget has a number of categories where we currently spend money that we will not need to spend any longer if the Medicaid expansion occurs. So one example is we cover pregnant women while they're pregnant in Missouri up to a certain level of poverty. There's a chunk of folks who would now be eligible for Medicaid who are currently covered under that program. So there will be cost savings there. There will be cost savings in mental health, cost savings in corrections, and hospital care for those who are incarcerated in the state. So all of that together means we will actually reduce our current costs in state general revenue by about $50 million within the first year. Even when we get to the point where the state is contributing 10% of the cost of the Medicaid expansion, we will still save money.
Amy Bluen, thank you very much.